here going over some specifics about medication ordering in CPRS. I am an outpatient attending in the resident clinic here at the Omaha VA. So my focus is on the clinic aspect. We're going to focus up here on the outpatient medication list. This is a patient who's going to be coming in to see us. And what I like to do is I'm taking my history is I like to incorporate in tolerance of the medications and asking them specifically for like tamsulosin. I use that as I'm doing my med reconciliation. How are they tolerating it? Are they taking it faithfully? And how are their urinary symptoms? Similar for blood pressure with hydrochlorothiazide. When my first glance, I look and see for hydrochlorothiazide that he last filled this medication March 11th. It's a 90-day supply. He has 2 remaining refills, and that prescription is going to expire October 13th of 2023. So I also noticed down here his diltiazem for blood pressure. He last filled that February 17th. That happens to be expired, and it expired on this date. But I can feel fairly confident that he still has medication because he filled it within the last 90 days. One thing that I like to do if I have any question about compliance with medication, I like to go to the reports tab and I scroll down to the VISN 23 medication reconciliation tab. I have my settings set, and you may have all these boxes checked, but I have only outpatient medications checked. And you would be welcome to clear them all and do that when you're in clinic and set that as your personal, save that as your personal default, and then close that. What I like to do if I'm seeing them for their annual exam or 6-month exam is set it for 1 year. And then I will look and see these bars. So you can see there's a little overlap here. That probably explains this gap right here. So if I look at this year's worth of refill history, I feel really confident that this patient has had ezetimibe tablets available for him to take daily. So this is a really good sign for compliance. I think it also, I'll use levothyroxine as an example too, because if they're missing doses, then I don't want to adjust the medication dose unsafely and end up with either too high or too low because the patient actually hasn't been very compliant. But you can see that little bit of overlap here probably explains this gap here and the same over here. So this patient has been very nicely compliant with their medications. So let's go back to the meds tab. After my visit, when we decide that we are going to adjust the dose of levothyroxine, one option is I can highlight, right click, and change. Oh, I can't because it's expired. That's a good reminder. I can't change a prescription that's already expired. If I wanted to do the same dose, I could renew it from here. Okay, I would attach the renewal request to the visit, and I'd hit OK. Now from here, let's say that he tells me he wants a 30-day supply instead of a 90-day supply. I can highlight that and change the date and supply. So it's easier than using the arrows there. If I leave it like this, he's going to have a 30-day supply with 3 additional refills. It's going to go out by mail. If he tells me that he is completely out and wants to pick it up at the window, I can pull that down and change that to window. If he picks it up at the window today, but subsequent refill requests will default to mail. So that's very nice because We like to do as much mail out as we can. We would want to be respectful, though, of the fact if we're seeing him back in a year's time, he's not going to have enough refills on that prescription to get him to that appointment. So we want to make sure that we are authorizing prescriptions that will not expire nor run out of refills between now and when you see that patient the very next time. So I'm going to go back to 90 days. Honestly, it's better on scheduled drugs that they have been on long-term to do a 90-day supply with 3 refills. It increases compliance and decreases how often they have to be burdened by requesting that refill. And it also saves the system money with regard to mailing costs. So, okay, terrific. So let's do that. All right. Let's talk about this medication, ezetimibe. If we check his cholesterol, we want to continue to have him take that medication, and it is April when we're seeing him, then we know that we only have 2 more months for him to access this refill. Since we're going to see him back in 6 months' time, I'm going to go ahead and right-click, and I can renew that or I can change it. But renew is what physicians do. We do not refill medications, we renew them. And what that essentially means is that we're rewriting it and we're resetting the date for today's date in April for a 90-day supply of his ezetimibe to go out by mail. Again, we could change that if he wants to pick it up or if he needs a smaller supply. And then we would hit OK. The system is going to give us some dose checks to be sure that we are aware that there might be some discrepancies in what we're prescribing compared to what's typical. And I can accept or deny that. Let's look at tamsulosin. It might be tempting to say, hey, he's got 2 more refills of 90-day supply to get him to October. I have to admit, I'm pretty liberal if I am addressing this medication today to go ahead and renew it, just because things can come up, patients can travel, schedules can get busy, and I want to make sure that my patients are not running out of medications before I see them next. So I'm going to highlight that, right-click, and renew. Again, refill would be if I was a nurse or a pharmacy tech and the patient's calling and saying, I want to access one of these 2 refills that I have listed right here. Okay, that is not rewriting the prescription. That is simply accessing and activating so that that would go out in the mail. Because I'm a prescriber and I want to reset this for a year's time, I'm going to renew it. And again, I can make the changes that we talked about before. Okay, so one thing that we should talk about too, let's say we decide that his pantoprazole is a medication he is no longer wanting to use. It's tempting to say, well, it's expired and we'll just leave it in the expired status. What I like to do is highlight it, right-click, and discontinue. And I like to select deprescribed if that's what I'm doing. And then it says see progress note. This has been extremely helpful for me because when a patient may call later and say, hey, I'm not getting pantoprazole and I need it, and the pharmacy would notify me of the patient's question or concern with regard to the pantoprazole, first thing I'm going to go to is I'm going to go to the meds tab and I'm going to open it up, and what it's going to show me is that on this date I deprescribed this medication. Then I can go to the notes section and I can read my note and get back with the patient and say, hey, my understanding was that you were not having any heartburn and we were going to discontinue that medication. And then we can have a good discussion about patient concerns. But I like to know for sure that I actually intended to deprescribe that. So that's why I like to discontinue. Let's say he tells us that he was having hives with his pantoprazole. You can select drug ADR or allergy adverse drug reaction. And then that's another really helpful reminder. If there's any question later why that medication was stopped, then it will prompt me to look at the ADR section on the cover sheet and scroll down and try to find it and say, okay, well, what did it, what symptoms did this patient have as an adverse drug reaction? You can click on it and it gives you also helpful information. Let's say I want to read more about this muscle pain and fatigue from the simvastatin. I'm going to go look for a progress note from the clinical pharmacist dated December 14th, 2020, and see if I can get more information. That's been really helpful for me as well. So the other thing that I recommend, let's say that this is a cream instead of pantoprazole, and the patient's no longer using it, it's expired. I might discontinue it and just say obsolete order. And what's really helpful for me is that when I select obsolete order, I know that I may not have necessarily talked to the patient about that. So I'm simply trying to clean up their medication list so it's a little cleaner. And I can always represcribe that cream later if I need to, but that tells me that I was reviewing the list. It appeared like it had been a long time since he had ordered it and that it probably was no longer needed. But I didn't actively discuss it and deprescribe it as a medication I didn't want him to take now or in the future. So that's how I differentiate those. Let's say that I accidentally renewed and prescribed pantoprazole, and the patient had said, I don't want to be on pantoprazole anymore. I took myself off of it, but I renewed it. If I'm notified of that and the patient's requesting a copay reimbursement for that prescription that went out to him in error, what I need to do is I need to go in and discontinue it and write entered an error. Then my team, myself, will provide the pharmacy billing phone number for that patient. So the patient can call and say, the provider ordered this medication in error so that the patient can get reimbursed for that copay if he had a copay for it. So that's how I use the reason for discontinue to communicate a lot of important things. Okay, terrific, terrific. Let's say I'm gonna order an additional blood pressure medication for this patient at this visit. Gonna use my master menu. I'm in the orders tab now. I'm gonna go down to pharmacy. I'm on the outpatient side. I'm always on the right. I select my outpatient med quick orders, which I really like, and I encourage my residents to use faithfully because it really helps decrease our errors, helps us consider dosing. It also helps us with quantities. So I can go to cardiovascular medications. It gives me a lot of different common options that are on the VA formulary and typical starting doses. So if I'm looking for an ARB, I can come over here and see that losartan is our formulary ARB that I can prescribe, and I can select it from here. Valsartan is only on formulary if I'm treating systolic heart failures. That's why this quick order is super helpful for me. So if I click on the losartan, and it tells me, oh, this gentleman had an allergy to fosinapril in the past, and it was a cough. As most of you know, ARBs are probably a good option instead of another ACE inhibitor, but this would be helpful if I had not paid attention to that and was looking to order a different ACE inhibitor, then I would cancel my order. Now the system is going to want me to justify why I'm overriding this historical adverse drug reaction. So I'm going to pull this down and say that I'm going to monitor closely for adverse effects. And then I'll hit continue. And this is helpful because it tells us what tier copay it is. And this is something that we can go in and talk to the patient about if they have a copay. That could be very important for them. So it'll give me my typical dose, but let's say I want to start at 25 milligrams instead. I can certainly change that. I do need to click and provide an indication. I want to be very respectful of the patient's health literacy. So hypertension may not be a term they're familiar with, but maybe they're familiar with high blood pressure. Diabetic nephropathy would be a term that would be a fairly high level literacy term. I may instead select for kidney protection. So you want to be very respectful of your patient's health literacy when you are using this. Let's say I'm using it for a different reason. I can override this, say for happiness. So you can override that if you want to. Okay, when I'm starting an ACE inhibitor, an ARB, a diuretic, an SGLT2, those are situations where we want to get lab monitoring probably a week or two after we started it. So I am not likely to want to give them a 90-day supply of a drug that they may or may not be able to continue past 2 weeks' time. So I typically will go in and do a 30-day supply and either 0 or 1 refill. And if they're going to pick it up at the window today before they leave, then I can certainly change this, or if we mail it. But it's important then that when I see that patient back, that I order the lab that's necessary, that they're aware that they have to go to lab. And then when they go and I review the results, if I decide that I want to continue this dose of medication long-term, I want to go back into there and change it to a 90-day supply with 3 refills. I was just talking with my residents about how important it is for long-term stable medications that we provide them a year's worth of refills. Many patients will make an assumption if I'm not diligent about changing that 30 days of medication was all I wanted and they don't need to be on it anymore. And then they come back 6 or 12 months later and they are not on it. And I have to take a lot of ownership of that. So, okay. So that would be how I would order a new drug. I want to show you quick orders for dermatology. This is where I think the quantities are super helpful in the quick orders. So let's say I am going to order some Eucerin cream, which is one of my favorites for dry skin, which, as we know, is uniformly a challenge in our patient population. I may not know that this comes in a tub, and the quantity dispensed is always written up here. So I can see when I order 454 grams, that's a tub. And since it defaults to 30 days with 11 refills, I can feel fairly confident that that's a reasonable 30-day quantity to dispense. And that's why that's important. Let me show you, if I were to order that hydrophilic cream, let's say instead of using my quick orders, I go to other outpatient medications and I can search for Eucerin cream. There it is. Okay. So I don't have the advantage of having all of these fields kind of preset for me, which I think those clicks make a big difference. Okay. So I would have to go in and type in, add this, and I would have to be very respectful of what the typical dispense quantity is and make sure. Now that defaulted to 90 days, but that might not get them 90 days. So that's why I like the quick orders, because it's super helpful with quantities and kind of your typical dispensing prescriptions. I think that's really helpful. So let me get rid of that. Supply items is a really great tool. Diabetic supplies. Let's say your patient is newly diabetic and he does not have a glucometer or any testing supplies. Ooh, actually, this is not the set that I like to use when I'm ordering a glucometer with all the test supplies. Let me show you the difference. I went under diabetic supplies, under supply items, but let me show you what's under endocrine, diabetic medications and supplies. If I scroll down here, I've got a layered set of orders for all of it, okay? So it defaults me to the meter that we have now, and I have to type in for diabetes. Of course, I'm only gonna send them 1 meter and there's no refills, and I can accept it. Then it's automatically gonna go to the test strips. It's gonna default to 50 tabs in 365 days or a year's time. So this would be somebody who's only on metformin, or I probably only on metformin. So, and I would have to type in here for diabetes, but let's say we were wanting insulin and we wanted them to test 3 times a day before meals. I could certainly change that. I would want to make sure that I offered in the quantity 50 increments. Maybe I did 150 for 50 days. And again, I want to make sure that they have, 5 to 6 refills to get them through. Okay. So I can accept that. And then next it'll take me to the Lancet device. We only need one of that. Diabetes. And the clicks that go in, the Lancets itself that goes in to the device. 100 of them, that's where it defaults, a box. Obviously, they may or may not use that many in a 30-day supply, but it defaults to that. And then alcohol pads. All right, so as you can see, that was so much easier than me having to go through the menu and pick out all of those different items. You can see alcohol pads are here. The endocrine, you're going to use this quick order set a lot. We've got insulin pens or vials. Remember, if you're ordering an insulin pen, you want to make sure you get the needle pin here. They have a great preset correction scale in some of these, and you can see on the aspart what sugars they would prompt them to take, and the quantities are here. That's also very helpful. So in this, all you would have to do is add for diabetes under the indication. So the quick orders offer a lot of great options that are formulary, that are preset to make it easy to prescribe medications. Let's say the patient is newly diagnosed with atrial fibrillation, and we're going to start DOAC therapy. This is super helpful. Atrial fibrillation, standard dosing. It guides us that apixaban, if this patient is 75 years or older, or has had a history of bleeding, is going to be the one we want to pick. And so I can do that and pick from there. If we have another indication, then it's really helpful here to make sure that we get what we want for the indication for our anticoagulation. So once I order the anticoagulation, I have to place a pharmacy non-formulary or restricted order. The reason our DOACs are restricted is because they are high-risk medications, and our pharmacists have a database that they put patients in and make sure they monitor to make sure that they are getting the labs that they need for their safety. And I may have to say, we don't have to do a lot of justification now over warfarin because it's the standard of care. But let's say I picked apixaban, and I might want to say that my patient is age 80 with a history of GI bleeding. Let me put that in there. We want to give the pharmacy as much information so that they can easily approve our medication and do it quickly so that that can get out to the patient. All right, so if you have non-formula, then we'll have to search here the lexicon for our diagnosis. And most of our pharmacy non-formulary requests are done within 1 to 2 days. So that's my clinically indicated date, and I can accept that order. Okay, so that is a lot of what I use on the quick orders. I can't emphasize enough how important those are for efficiency and safety. The other plug I want to make is, let's say my patient has acute sinusitis. I like using the NWI antimicrobial CDSS outpatient menu. This helps us prescribe antibiotics respectfully according to stewardship and IDSA guidelines. So the very first step is I got to find my condition that I'm treating. I know that sinusitis is under head and neck, and it's right over here. And this is great because it reminds us that the outpatient guidelines suggest most cases of acute sinusitis are viral and they're going to resolve within 10 days. And give us some guidance on whether or not the antimicrobial that we are considering is truly evidence-based and safe for the patient. So let's say we decide, yeah, they meet criteria for antibiotics. So I'm going to click there. And if most patients do fall under mild to moderate that we see in clinic, and this will tell us that Augmentin is our preferred agent. Now I want to be looking at and confirming with my patient they'll have an allergy to penicillin. If they don't, I can click on this. And we want to make sure we keep this pharmacy confirmation information there. This helps us track the use of the CDSS ordering menu, and there are some performance measures that we get a lot of kudos for using this. So I would want to make sure that this would be a situation where I'd probably override and type in for sinusitis. And then it defaults to the number of the days and quantity, which is very helpful because then I don't necessarily have to look it up. And most patients are going to want to pick that up at the window. One thing that we've been able to accomplish during COVID is if we have a patient that we're doing a video visit or a phone visit on, and we need to order a medication and we would like a quicker mail out. Let's say we're doing a video visit for this acute sinusitis and I'm prescribing this Augmentin. The patient's at home, doesn't feel good enough, doesn't have transportation to come in. I'm going to add here, please mail from Omaha. And that way it will go out quicker for that patient. So that's a really nice feature that we can communicate with the pharmacist in those situations. Okay, so go back. Let's say the patient comes in and said, I have an outside provider who is prescribing me a different blood pressure medication. Let's say in this case, it's losartan again. We'll type it in. I want to document this. And again, it reminds us that he's had a cough with lisinopril. So, okay. And his doc's giving him a 50 milligram dose daily. Still am going to select here. And he told me that the patient, he's going to continue to get it from an outside pharmacy. It is prescribed by a non-VA provider. I may even type in if I know which provider that is, Dr. Dr. So and so. And I'm going to document today's date so that it's clear to me when we last discussed that. And then I can accept that order. And you'll notice if we go back to the meds tab, if I signed it, which I haven't, it's going to show up under the psyllium powder that we documented he was taking over the counter. So that's where that will show up. So that is a very helpful piece of information. We want to make sure we are aware of the herbals and supplements and outside medications that they are on. All right, I believe that is all I have to share with you today, but I wish you all the best in your onboarding. Thank you.